Welcome back to Life's About Living. I'm Dr. Page, the best guy to see on the worst day of your life. And I have with me a very interesting guest, Dr. Sal. Dr. Sal has been a pharmacist for 40 years, a pharmacologist. He has a lot of experiences. In fact, in the last episode, we learned that Dr. Sal was one of the chief contributors to cardioplegia, something we use in heart surgery to stop the heart so that we can sew the blood vessels to do a bypass. Dr. Sal, back in the day, was very involved in that. One of Dr. Sal's passions is men's health, and he's very involved with Men's Health Network, and you can find his resources at menshealthnetwork.org. They've got a lot of resources for men. And Dr. Sal, I was interested, one of the past episodes we were talking about how you also had information for women. And so it's interesting. Tell us a little bit about that, and tell us a little bit about men's health and your contributions there and your passions with helping men.
That's very nice of you. I appreciate it. It is something I'm very passionate about. I didn't always have the best healthcare outlook, even though I'm in healthcare. I wasn't always as cognizant as I should be. So part of my passion is driven by my own mistakes. So part of it is helping guys in their 30s when they should be thinking about their life in their 70s, where I am, what kind of life they want to live. But
what's that old saying? We spend our health to get wealth, and then as we get older, we spend our wealth to get health.
Right. Yep. Well, that's very true. And sometimes you can't get it back, and that's what concerns me the most. You know, folks don't realize that of the 10 leading causes of death in the United States, men lead in 9 of them.
Wow.
The average lifespan of a guy in the United States for the past 40 years has been somewhere around 5 years less than for women. And most of these reasons for the earlier death from the guys are primarily from preventable diseases, cardiovascular disease, pulmonary disease, obesity, diabetes. You go right up and down that list, and you will find probably half the patients that you see, the guys have some sort of poorly controlled condition in that top 10 reasons for death in the U.S.
One of the things I found interesting that you mentioned is that you have information for women about men. I see this all the time in the office. We have the men come in and they don't say much. And the women are the one that does the talking. The women are the ones that are concerned about their husbands. And so I think that's very interesting that that the Men's Health Network has literature for them to educate them about what to look for.
Yeah, we have a lot of informational material. Part of it is a couple of brochures on what women need to know about men's health. We actually also have a couple of brochures what men need to know about women's health, because women have certain chronic conditions, so multiple sclerosis and such. We have material for there. We are strong advocates for the fact that guys have to take a page out of the women's health playbook and be responsible for their own health. When the media and how kids are brought up from the very earliest years, what does Johnny usually hear when he falls down and scrapes his knee? Get up and take it like a man. Yeah. When we watch sports, we see football players and we lionize the football player. And what do we usually? Oh, he's such a great competitor and he's so good for the team. He's playing hurt. You go to women's sports, and women get hurt in sports too. Some are very physical, but they do tend to take time to heal, and they don't try to play hurt. They heal themselves. When you look at, I did a study once that was published in the Journal of the American Public Health Association on print advertising of healthy material or healthy products for women and girls, boys and men, and those are 75%, Dr. Charles, were geared towards women and girls. And when you
look, amazing, isn't it?
It is. And just all the folks listening, watch TV for a little while. And when you see an advertisement coming out on TV for a health product, a health service, or a healthy lifestyle, look at who is leading the charge. So, sure. American.
It's very interesting. That's very interesting observation and a very interesting study. And I really like how you guys are just increasing awareness. It begins with that. So let's break this down, Dr. Sal, into some different types of disease. I'm just going to let you start, and you pick you pick a men's disease you think that you're passionate about, and let's just talk about that a little bit.
Number one has got to be prostate cancer.
Yep.
Now, prostate cancer, if it's diagnosed, like many cancers, but prostate cancer in particular, if it's caught early on, is very, very curable. I've forgotten the number off the top of my head, but it's somewhere around 80%, 90% curable if you get it early on and you do the right things and you get followed.
And you get a blood test, a PSA, which is it's a prostate-specific antigen, so it's very specific for cancer. It's not 100%, of course, like every test, but it's a great start, and it's an easy thing to do.
Exactly, and it's all covered by just everybody covers PSAs. You should be getting it regardless of what age. I get mine every 2 years because I'm over 70, but I do get them every 2 years. And I have the other thing that goes with it. If you do see a rise in this enzyme that's secreted by a prostate that is overactive, which has these overactive prostate tissues have a tendency to become tumorous. So the other thing that goes with it, if you have a PSA that's even slightly elevated, you get the old fickle finger of fate exam.
Yeah.
But basic, guys, women go to gynecologists from a very young age, and they have invasive exams, and they don't complain about it because they realize getting cervical cancer or other reproductive organ disease is easily detected by just a simple examination. Guys, man up.
And same here. It's really, the old joke, you know what a second opinion is, 2 fingers. It's really not that bad. And so,
no, it's not.
The great thing about prostate cancer too is how it's treated now. In the past 10 years, man, the robot has really not only surgical treatment, but radiation treatment. Now they have very specific proton beams, and seeds. We've got all these different treatments for prostate cancer, even non-surgical treatments that are just as effective. And so it's one of those things. I mean, why not get screened? I mean, there's no real reason not to do that. So awesome.
People don't realize that prostate cancer can spread to your bones.
Absolutely.
And very quickly. You can have a very aggressive, I've seen patients when I was working in one of the military clinics that I did some work in, who were, believe it or not, in their 70s, and they had very aggressive prostate cancer. And 2 years after, they were clean all their life. And 2 years after, they were in bad shape because it wasn't caught early enough and it wasn't treated aggressively. So
it's like everything.
No matter your age, go get it checked.
Yeah. So what would be your second men's health disease on the list you'd like to talk about?
Cardiovascular health, and that includes high blood pressure, high lipids, congestive heart failure, and all the other things that go along with poor cardiac flow. When you look at the number of options that we have to treat high blood pressure now, it's just a matter of being diligent. There's no substitute for leading a better lifestyle, for losing weight, which I am perennially trying to do. Amen,
brother.
I've lost about 17 people already in my lifetime. But I do try to be aware of it, and I try to control it. But blood pressure, lipids, they're all very, very important things to control. And just getting those under control can extend your life a significant amount of time. Diabetes is the third. And that kind of goes along with cardiovascular disease. They sort of feed on each other, if you will. So, managing diabetes, managing cardiovascular disease, lipids, and hypertension are extremely important for the guys. And when you look at killing things for the guys, they're right up there.
And then smoking cessation. We were talking about the men back in the day, the Marlboro men, kind of the mentality we were talking about at the beginning of the show. Men have this mentality that I'm Mr. Tough Guy. And man, smoking is one of the worst things you can do for your heart blood vessels.
Yeah.
It's interesting too. We have such an epidemic of obesity in our country. And I see this in men as well. Diabetes and high blood pressure and all those things are linked to it. Sleep apnea is another thing. If you're having problems sleeping, getting those checked, just simple things that men don't typically do because, I think it's hard for men to kind of
man up.
to man up and just realize that, hey, I'm not gonna, I'm not gonna live forever. So if you're not feeling good, think about some lifestyle changes. Think about maybe going and seeing your primary care doctor and having some of these things checked. I think that's one of the things, Dr. Sal, that you're really trying to do on the Men's Health Network. What would be another disease that you're passionate about and the Men's Health Network is passionate about, Dr. Sal?
Well, when you look at all the testicular cancer is another area. Again, the analogies to women who are very knowledgeable about how to self-screen for breast cancer. It's just a simple physical exam done routinely. It's a very simple sort of thing to do, and they are attuned to, if they see something, they say something. They go to their primary care or their gynecologist, but they talk to their healthcare provider. Guys, the same thing, particularly young guys. Testicular cancer is a very bad thing. It's not only you can lose your ability to have children, but also it has tremendous impact on your overall ability to live and your lifestyle and what you can, your life potential.
But once again, picked up early, it can be treated very easily, and once again, seminomas and testicular cancers, typically that's a palpable, mass. I know this is on television and everything, but it's a palpable mass that you can feel. If you feel something abnormal, just go see your physician. Because testicular cancers are real. It's interesting too. You mentioned breast. Men can have breast cancer, Dr. Sal. And, the only difference between men's cancer and women breast cancer is the fact that there's a delay in diagnosis. Historically, men's breast cancers are diagnosed later than women's. And so it's a very important thing to think about. It's because, like you said, it's that man up thing. We just don't want to get checked. Men also have breast tissue, interestingly.
Yes, absolutely. Particularly when you get a little older, sometimes your adipose tissue in your breast is larger. But you got to watch that, you know. And there's no reason that you or your partner can't give yourself a check.
Dr. Sal, it's really been great having you on the show on Life's About Living. You're very knowledgeable as a pharmacist. You've had a lot of life experiences. You've had a lot of clinical experiences. You've done a lot of research. You've been on a lot of boards, and I know you're very passionate about the Men's Health Network. Tell us real quickly about how people can get in contact with the Men's Health Network and some of the resources that you have there for people.
As we talked about, we have a lot of information, educational information for guys, young guys, older guys. They're the women who love them, their daughters, wives, spouses, girlfriends. It's at www.menshealthnetwork.org, www.menshealthnetwork.org. Most of the information is free, and we encourage you to look, and you can learn an awful lot.
Dr. Sal, it's been great having you on the show, man. You're just very knowledgeable. Someone to remember all that pharmacology and stuff. We had like 2 classes in medical school, and you spent your whole life studying drugs. So it's really interesting to get a different take on this. And we really appreciate having you on the show. It's been great. This is the 3rd episode, and you can find the rest of these on our website, lifesaboutliving.show.com. Or you can text LAL to 66866 and get these shows. But Dr. Sal, it's just been a real honor. We just want to encourage you and just give you a pat on the back for what you're doing, just helping men become more aware of disease. And so I'm going to give you the final word.
Well, I appreciate that, and I'll pass that along to my organizations. Guys, you have to take responsibility for your own health. And pass that knowledge and that information and that passion for your own health onto your sons. And granddads out there, you play a role there too. You can be a real encouragement to your grandsons and your granddaughters about taking care of your own health. So important to be a good role model.
Dr. Sal, it's great having you on the show. So guys, don't forget, man up. Thanks for being on Life's About Living.